Hello, I'm Dr. Perry at Farmington Family Dental. I wanted to talk to you about some questions that I get about oral surgery. There seems to be a lot of fear in the community. Sometimes people are worried about hearing that word surgery. If you watch these videos, I'll walk through what oral surgery is, what things are considered oral surgery, and what we do here at Farmington Family Dental if you need it. Okay, so one of the first questions people ask is, what is oral surgery? Oral surgery is just simply doing work inside the mouth. Now, if you're a dental nerd like I am, when you look at the titles that dentists have, one of the most common one was DDS, Doctor of Dental Surgery. Everything we do where we're picking up a handpiece, we're getting you numb, that is surgery. There are surgeries that are more complex, more simple, some that have swelling afterwards or discomfort, others that don't have anything. The last time you had a dental filling done, that was surgery. What most people think of when they think of surgery is something like having a tooth extracted or having bone graft placed or an implant put in your mouth. Those are common examples of surgery that we do here in our office on a day-to-day basis. It is, surgery is kind of an intimidating term. So as dentists, we tend to shy away from it a little bit because there's no real reason to make something bigger than what it actually is. It's getting numb and having something done. And nothing really to write home about there. We do it every day, day in, day out. That's what we do. So what happens during oral surgery? Most oral surgeries are involving taking a tooth out or putting a new one in, like an implant or putting a filling in or putting a bridge in or something like that. During an oral surgery, the first thing we do is we get you good numb so you're not feeling anything. I don't want you to be hurting. I don't want you to be feeling anything, no toughing through it. That's crazy. The anesthetics we use are very comfortable, and in a lot of cases, the injection is a lot less than you'd think that it would be as far as its discomfort. Many times people don't even feel them. During an oral surgery thing, what we do kind of depends on what's going on. So if we're taking out a tooth, we get it good and numb, and then we wiggle the tooth out. After every event where you meet me or Dr. Wynn or any of the dentists here at Farmington Family Dental, we'll make sure that you're comfortable and taken care of with good instructions before you leave. And if you need us, simply give us a call. We're just a phone call away. Oh, can my regular dentist perform oral surgery? Absolutely. General dentists are competent and trained in a lot of different aspects of dentistry. There are some things or there are limitations to where we found that those procedures don't work well in our office or we're not very good at them, so we don't offer them. And that's where we will tend to refer out to a specialist, an oral surgeon in this case, or an endodontist or a prosthodontist in other cases. Those are the common specialists that support me in my practice, and we refer to them when needed. But one of the things we do here a little bit differently from most offices is we take care of most things here in the office. So you don't have to go out to another provider. You don't have to meet a new staff. And that's kind of a challenging or tough thing to do because you get used to our staff, our office, and how we function and operate. And you kind of have your favorites. So we try not to send people out and have that experience somewhere else because tends not to be as good as what we can offer here. It's a little bit cheaper typically too when it's a general dentist doing the procedure rather than a specialist. Okay, so sometimes people ask me about, anxiety. What anesthetic opportunities are there? What can we do? Can we put you all the way to sleep? Are we awake for this? And usually that comes from a little bit of place of the fear, worried about what it's going to feel like when the work is done. The options we have here in our office, we have anything from just local anesthetic numbing the area we're working on, all the way up to all the way asleep. We contract with sedation services here that we bring in an outside provider to do the sedation part, and I just take care of the dentistry. All of those are options here. Ask me more about them when you come in with your particular situation, and we'll see if it's a good fit for you. If so, great. Let's get you taken care of. Let's get you comfortable. Gosh, can you drive yourself home after oral surgery? Typically, yes. I say typically because there are some cases where that's not the case. In most cases, it's just numb. It's just numbness. You'll be just fine. Drive home. It doesn't affect your ability to stay awake or be alert or be attentive or your reaction speed. So, yeah, it works great. Just drive home. It's really convenient. When we use anxiety medications, or if we're sedating you, I want you to have a driver to and from the appointment. That makes sure you're safe, you get home taken care of. And with the halcyon type medications we use, those are anxiety medications, by the way, you need a driver to and from, and you're probably taking a nap that afternoon. It's probably going to be the best nap you've had in years, which if you're a parent, that's like gold. So in most cases, no, you don't need a driver. If you do, I will let you know. We'll have a conversation about that. How do I minimize pain and discomfort after oral surgery? This is like a red button topic. A lot of people are concerned after having a tooth taken out, how do I take care of it? Long and short. Ibuprofen is your best bet as far as your pain and the swelling associated with having a tooth extracted or other forms of oral surgery. Ibuprofen, anytime somebody comes in here and we do a procedure, I'm going to tell them how to take the medication and what to take. About 95% of the time, I find ibuprofen will take you down to a level of discomfort afterwards where it's just sore. Not a big deal. If we used heavier medication than that, we'd kind of knock you out of your mind. A lot of people describe some of the heavier ones as making them nauseous, sometimes anxious, and just they feel sick. That's not worth it. When the ibuprofen does a good job, we'll use that. If we need something more, we'll do it. Whatever we need to do to get you comfortable after your procedure, we will do. Ibuprofen and Tylenol are our go-tos here. Thank you. Okay, does dental insurance cover the cost of oral surgery? Yes and no. Most dental insurance plans are designed to cover a portion of whatever dental needs you have. I've seen anything from about 20% coverage all the way up to 100. It really depends on your plan, and I can give you a good idea of that. What is typical is they'll cover anywhere from like 50 to 80%. The Delta Dentals and the Cignas and the MetLifes of the world are pretty run-of-the-mill insurance with nothing real special about them. There are some plans like the Medicaid or Medicare type plans where they work on different principles, and they can be wildly different from that. So if you have a question about this, come on in. I can have the gals look through your individual insurance and get you a good answer that's specific to you. Okay, so finances around oral surgery. Sometimes when we're talking oral surgery, we're talking about putting implants in or replacing teeth. It can get expensive. And in order to make that affordable for people, oftentimes what's needed is just breaking that up into a monthly payment, kind of like you would do if you bought a car or a house or something like that, where it's just a big expense, or a large medical bill. Breaking it up into payments is what we do here. We use a couple of different financing companies that allow us to do that so that you can have the work done that you need done and pay a monthly on it instead of all up front and having to save for it in the meantime, suffering with pain or missing teeth. Give us a call. Come on in. We're more than happy to go through some of the financing options we have here and find something that works well for you. Gosh darn, an appointment to discuss any of this. If you need one, give me a call. We're open, normal business hours. Give us a call. We'll be able to get you taken care of. I hope we've been able to answer some of your questions on oral surgery. If you have any more, feel free to reach out to us. You can get a hold of us at 573-756-5760. Give us a call. We'll get you an appointment. We'll get you sitting with me and I can talk with you about what you need to get you taken care of. There's nothing like having a nice smile that looks and functions well for you. Thanks.